Hello everyone, I am Laurent Faugère. I am the CEO of Urgo Medical, and it's a great honor and pleasure to make the introduction of this symposium at DFoot International. I would like to take the opportunity of this symposium to say a few words about Urgo Medical and to explain you why we have decided to launch such a program. Everything starts with our mission, the mission of the people that work at Urgo and that are passionate about what they do, passionate about the mission that guides us in what we do. What is our mission? Is to heal people, is to help you, healthcare professional, to better manage your patient and to heal your patient. And how we do that? First of all, we do that with innovation. We invest in R&D to have better treatment. And what do we mean by better treatment? Is treatment that will reach your number one objective. And the number one objective of your patient is to reduce healing time, to close wound faster. And this is what we have done through the Explorer study with the recognition that you know in the Lancet, in the NICE, by the international guidelines and many other recognition. We are very proud to have been able to bring a treatment to you. But we know it's not enough, and this is why we have decided to go beyond the product, but to build a more holistic program that is called Closing Wound, Save Fit, Save Life. This program has 3 pillars, and those pillars have been built based on your feedback, on what was needed to improve DFU management. The first pillar is about the organization of care, improving the organization of care. We know it's critical in DFU. We have to have a multidisciplinary approach. We have to know at what time the patient needs to be sent to a specialist or a center. And we are working with you to share the best practice around the world around this organization of care. The second pillar is about standard of care. How can we implement the best protocol based on evidence-based medicine? And the third pillar is about education. Education of healthcare professionals, but also patient education. Education of their families. We know that they are very important to improve prevention, to have a better early identification of the DFU patient. And this is what we have decided to launch an awareness program for those patients to improve their knowledge of the pathology.
Une personne diabétique sur 4 va potentiellement développer un ulcère du pied.
Una lesione del piede diabetico può iniziare con una semplice ferita, una puntura oppure un graffio.
But because of diabetes, that blister, cut or scratch can easily turn into an open wound that can take months or even years to heal.
Años de aislamiento y movimiento restringido cuando apenas puede salir de casa.
Cada día con una úlcera de pie diabético es un riesgo de infección que puede conducir a una amputación y que puede suponer un grave riesgo para la vida.
Alle 20 Sekunden erleidet jemand auf unserem Planeten eine Amputation aufgrund von Diabetes.
COVID-19 pandemic has made the situation worse for diabetic feet, increasing possible complications.
Ganz wichtig und insbesondere in Zeiten von einer Pandemie ist es, regelmäßig die Eigenvorsorge wahrzunehmen und als Patient idealerweise täglich die Füße zu inspizieren.
Ogni giorno qualche persona affetta da diabete soffre per una nuova ulcera al piede. Se tu o qualcuno della tua famiglia siete affetti, adesso possiamo agire.
Comment? Voici 4 étapes pour préserver votre pied et prévenir l'apparition d'une plaie de pied.
Step 1, check your blood sugar levels.
Deuxième étape, examinez vos pieds tous les jours.
Take care of your feet.
Fase 4, indossate calzature adeguate.
Grazie all'educazione e una corretta cura, fino all'85% delle amputazioni degli arti inferiori possono essere evitate e molte vite possono essere salvate.
Check the feet daily and take care for minimal lesions immediately, and do not hesitate to contact your GP if lesion is present and will not heal.
Save feet, save life.
Save feet, save life.
Save feet, save life.
Save feet, save lives.
Hello, I'm Heidi Corcoran and I'm a podiatrist working in Hong Kong, and I'm the Vice Chairman of the International Podiatrists Association of Hong Kong, and I'm also the President of the International Federation of Podiatrists. It's been my pleasure to work with Urgo Medical over the past few years. I'm an advisor to the Asia Pacific Advisory Board. I'm working with colleagues in 8 other countries in the Asia Pacific region, and we work together to devise ideas and strategies to help prevent diabetic foot ulceration in our region. In Hong Kong, we've got a population of over 7 million people and an incidence of diabetes mellitus of between 8.5% and 10%. This means that over 700,000 people have diabetes in Hong Kong. Working with Urgo, we devised a website called Save Feet, Save Lives Hong Kong. The website was produced in an English version and a Chinese version in simplified and also traditional Chinese characters. The website was geared towards healthcare professionals on the one hand, so we were able to give healthcare professionals in-depth information about how to diagnose diabetic foot problems, how to treat them, and where they could refer their patients, and how to give their patients advice. On the other hand, our website for the public and for our patients gave very detailed information about how patients could use very simple measures to take care of their feet and look after themselves, and how to spot a problem. And in the event of finding any foot problem, it gave them guidance about how they would be able to find a local person who would be an expert in diabetic foot care in Hong Kong. They would be able to locate services in the public healthcare system, in the local general outpatient clinics, or with a podiatrist or in the private sector. We launched our campaign on World Diabetes Day in 2020, and the launch was not as widespread as we'd hoped because of the pandemic, but we also produced some leaflets also in English and in Chinese to give to our podiatrist colleagues working in the government hospital or in the private sector, and also to distribute to doctors and nurses working throughout Hong Kong. This year, on the World Diabetes Day on the 14th of November, we're planning to continue our launch of our website, and we're planning to promote further. And I've gathered together a team of volunteers who will go out and promote all of the resources that are available to the public and our patients. And we look forward to doing more work in this area in the future. The most important thing is that by helping to inform our colleagues, the patients and the public, is to try to get across the message that if a person with diabetes develops a foot problem and they get an ulceration, they will know where to get the resources to help them. And the really good news is if patients are able to contact an expert in diabetic foot care and work together in a multidisciplinary team to look after them, 85% of amputations are preventable. And it will really help us in Hong Kong to avoid that shocking statistic that every 20 seconds, somewhere in the world, a person with diabetes loses their limb because of a diabetic foot ulceration. So I look forward to continuing to work with Urgo Medical. They've been a massive support to us and really given us the impetus to get this whole project moving. So I encourage you to please join us on World Diabetes Day on the 14th of November. Come and see our website at Save Feet, Save Lives, Hong Kong.
I am Dr. Hari. I am actually the head of the wound care unit, the Department of Internal Medicine in Kuala Lumpur Hospital. in Malaysia. Our population has got about 20% the incidence of diabetes mellitus, and there's a huge amount of amputation. One of the behavior models that we should actually cover, or the health models, is to actually start prevention. We actually launched the campaign last year on the 9th of November during the Central Zone Conference. And that was launched by the head of the National Committee on Wound Care from the Ministry of Health. We actually launched the campaign out to nurses, the paramedics, doctors, basically from the private practice and also government hospitals. And this involved the health centers, GPs, and also public hospitals which had got wound care teams. I'm actually involved as one of the representatives for D-Food, and this was actually launched by Urgo Medical together with D-Food International. The launch involved the posters, buntings, and banners given out also to the participants who came from the different centers. We have a website for Malaysia itself, so it was translated into a national language to allow not only patients, caregivers, and also the healthcare professionals to visit. WhatsApp is used quite extensively in Malaysia and also in the region. So we actually shot out or blasted out the news about Save Feet, Save Lives campaign to about 146 hospitals and more than 450 GP clinics. I mean, these are healthcare professionals, these are GPs who have decided that, they need to refer early for early intervention, for comprehensive management. So that actually helped. And it was enlightening to see a lot of them actually calling up to have discussions with you. For the next global conference, we want to get the ministry involvement so that the campaign can be launched in every state. We'll be giving out the pamphlets, brochures, we're giving out towels, we're giving out mirrors for food assessments. And also one of the things that we're working with Urgo Medical is coming out with the food assessment kit, whereby we'll be giving out to GPs and health center, medical officers and specialists. So that will be an early stage so more assessments can be done. Very, very crucial campaign, which has to be supported and has to be rolled out in every region of the world.
My name is Marco Meloni. I work in Roma at the Diabetic Food Center at the University of Tor Vergata. Italy is one country with the lowest rate of major amputation among the high-income countries. Nonetheless, there are still many barriers in the management of diabetic food. The main issue is the late referral of a patient with a new food problem. The second one is the delayed surgical treatment of a patient with critical diabetic food. According to this daily clinical issue, the scientific community approved and promoted in the last 3 years the DFU campaign with the aim to achieve 3 specific goals. The first one is to increase awareness among healthcare professionals and patients. The second one is to increase education among healthcare professionals and patients again. The third one is to increase the early referral to specialized diabetic food service of a patient with new food problem. The campaign has been promoted by national conference, regional meetings and local meetings involving many healthcare professionals working in the community, such as diabetologists, vascular surgeons, GPs, nurses and podologists. The main tool used in the community has been the fast track pathway. The fast track pathway is a simple clinical tool addressed to less expert healthcare professionals, in which we have a specific definition of ulcer severity, and according to each grade of severity, we have a specific way of treatment and a specific time of referral. The fast track pathway is accompanied by 2 modules approved by D-Food International. The first one is addressed to less expert healthcare professionals, in which we have a global management, a global indication for the management of DFU, including also the signs of alert such as ischemia and infection. The second module is addressed to patients, relatives and caregivers with a complete description about home medication. The fast track pathway has been implemented in Italy and specifically has been implemented in the last 2 years in in Lazio region, and after its implementation we have reported the data about its effectiveness. And among 200 patients, we have 25% of patients with late referral, a good result in comparison to the 50% of patients with late referral reported in a recent survey across Europe by International Diabetic Foot Care Group. Not only, but early referral patients reported good outcomes in terms of healing, because among 106 patients, 90% have wound healing after 6 months of observation, and only one patient reported major amputation. We know that we are only at the first step. We need to reinforce awareness, education, and knowledge, not only in our reality, but also in all hidden reality across the country, but we have already good results. This one is only a preliminary data, is only the first step. The second step will be to involve also patients, because patients is the main actor of this very deadly disease, and we have to increase education and awareness about diabetic foot. Thank you very much for your attention.